Hi, here I am again about possible important information about what's going on in our country and the world. I make notes about topics that I might want to investigate, and there are many notes that I have about COVID-19 and topics that are related to that. And these are some of them. People of color and vitamin D, and I've already spoken about that. Acyclovir and COVID-19. Interesting topic. Issues of cilia deterioration in the lung alveoli and COVID-19. Hair loss and cilia deterioration by aging might relate to why older people tend to be more afflicted by the disease and have a higher mortality rate. And tuberculosis and the BCG vaccine and how that might relate to COVID-19. Now, the additional, which I've already made a couple of videos about, is vitamin D levels and the immune system, racial, ethnic variations, and all that. So I'm not going to go into that. But what has really sparked my interest is in the possible relationship between the BCG vaccine against tuberculosis and possible applications to other viral infections, including COVID-19. So, let me continue here. What is different in the bodies of those exposed to COVID-19 and do not get the disease, who do not suffer from, the extremely contagious and often death of COVID-19. Well, after reviewing the list, that's the topic that most interests me. The correlation between COVID-19 immunity, possible immunity, and the BCG vaccine, which is to vaccinate against tuberculosis. Well, initially, the novel coronavirus epidemic was described as strange, very contagious pneumonia. Well, since tuberculosis is a lung disease, that's where I'm going to begin. When I put that phrase into Google, I was surprised that I'm not the only one interested in investigating the link between the correlation of the BCG vaccine and COVID-19. Well, here I quote documentation about especially the BCG tuberculosis vaccine. And I have to interject here that during my second year of college, my first year I was pre-med, discouraged from going into medicine because I was a woman, and that's a whole nother story, and I'd love to expound on that. But at any rate, so I spent my second year at the University of Minnesota in their RN nursing program. Well, all incoming students were given the BCG vaccine, including me. Now, skip ahead 50 years, and I'm living in the jungles of Central America, where tuberculosis is rampant. My husband, Army General Medical Officer, is exposed to the same contagious diseases that I was, specifically tuberculosis. Years later now, he experiences respiratory complications and asks me, now divorced for 30 years, if I've had any respiratory problems that might be related to the tuberculosis epidemic back in Panama. Well, I say no. And I follow up with, I had the BCG vaccine when I was in nursing school, and I should have been immune to tuberculosis while living in Panama. Well, now let me go on. Here is the research material that I found about the BCG vaccine and how it might relate to COVID-19. Now, I'm going to quote from the Associated Press investigative report as shown in the NBC article that I found. So let me just read from that article. And this is from Associated Press, April 13th, 2020. So it's yesterday, current. Scientists are dusting off some decades-old vaccines against other germs to see whether they could provide a little stopgap protection against COVID-19 until a more precise vaccine arrives. It may sound odd. Vaccines are designated to target specific diseases, but vaccines made using live strains of bacteria or viruses seem to boost the immune system's first line of defense, a more general way to guard against germs. And history books show that the sometimes translates into at least some cross protection against other completely different bugs. All right, next paragraph. Full coverage of the coronavirus outbreak. There is no evidence that the approach would rev up the immune system enough to matter against the new coronavirus. But given a brand new vaccine is expected to take 12 to 18 months, some researchers say it's time to put the approach to a faster test, starting with a tuberculosis vaccine. Now I'm still quoting. This is still a hypothesis, said Dr. Natia of Radboud University Medical Center in the Netherlands. But if it works, it could be a very important tool to bridge this dangerous period until we have on the market a proper, specific vaccine to COVID-19. Well, the World Health Organization issued a stern warning Monday last week not to use the TB vaccine against COVID-19 unless and until studies prove it works. Well, already 1,500 Dutch healthcare workers have rolled up their sleeves for a study that Natia's team is leading. It uses a TB vaccine named the very BCG, which is made of a live but weakened bacterial cousin of the tuberculosis germ. That's the one I had. In Australia, researchers hope to enroll 4,000 hospital workers to test the BCG vaccine, and 700 already have received either the TB vaccine or a dummy shot, a placebo. Similar research is being planned in other countries, including the U.S. Possibly next in line will be the oral polio vaccine, drops made of live but weakened polio viruses. The Baltimore-based Global Virus Network hopes to begin similar studies with the vaccine and is in talks with the health authorities. The network's co-founder, Dr. Robert Gallo, told the Associated Press. Rapid studies are needed to tell whether there could be long-range effects for any second wave of this COVID-19, said Gallo, who directs the Institute of Human Virology at the University of Maryland School of Medicine. At the U.S. National Institute of Health, researchers are in early discussions about proposals to study the TB and polio vaccines, said Jennifer Routh, a spokeswoman for the agency. There's a big caution. Live vaccines are risky for people with weakened immune systems and shouldn't be tried against COVID-19 outside of a research trial, said Dr. Denise Faustman, Chief of Immunology at Massachusetts General Hospital, who is planning a TB vaccine study. You can't just roll it out, she said, but it's kind of an amazing opportunity to prove or disprove this off-target effect. Now, the next paragraph, the first clues. Years ago, scientists began noticing with several live vaccines what Dr. Victor Nizet, an immune special systems expert at the University of California, San Diego School of Medicine, calls an important curiosity that people have been interested in trying to harness. BCG is given mostly to newborns in developing countries, and it offers only partial protection against TB, a bacterial infection. But observational studies showed that during childhood, the vaccine tots had been overall survival rates better than overall survival rates, including from respiratory viruses. In 2018, Natia's team published a more direct test. It showed that BCG stimulates initial immune defenses enough that it had at least blocked other viruses given experimentally a month later. Well, now what about the polio vaccine? Those clues emerged first from the former Soviet Union, said Konstantin Chumakov, a vaccine specialist at the Food and Drug Administration, who stressed that he was not speaking on behalf of the FDA. His mother was a Soviet scientist who published research in the 1970s showing that flu cases dropped markedly after oral polio vaccination. In 2015, Danish researchers also found some hints of cross-protection after oral polio vaccinations. The oral drops are still used in developing countries, while the U.S. and other areas that have eliminated polio use, they use the inactivated shot for routine childhood vaccines. There are overlapping types of immune defenses. The usual goal of a vaccine is to prime the body to recognize a specific health threat and make antibodies able to fight back when that particular bug comes along. But that takes time. So the first sign of an infection, a first line of foot soldiers, which are the white blood cells, springs into action to fend off the invader in other ways, what's called innate immunity. If they fail, then the body creates its more targeted special forces to join the fight. BCG appears to be reprogramming innate immune cells so they can more readily eliminate the germ up front, said Natia, the Dutch researcher. Scientists not involved in the effort say it's worthwhile to test. The scientific rationale, I think, is quite logical, says Nizet, the UC San Diego immunology specialist. The unknown is whether coronaviruses are in the spectrum of things that are efficiently protected by first-line innate immunity. Some scientists have theorized that countries with large BCG vaccinated populations might fare better in the pandemic. But given problems with accurately counting the toll, it's far too early to draw any conclusions, a caution the World Health Organization reiterated on Monday. Well, even though this is rather an open-ended discussion, I thank you for watching, and I'm going to follow up on this and see what current information is available about the BCG vaccine as a possible stopgap measure to combat the COVID-19 spread. And time will tell, but get back to me, and I will hopefully see you soon.